UKMLA has been a hot topic right now, and I'm here with some of the facts that GMC has released about UKMLA. So, GMC has officially announced the launching of UKMLA in 2024. That means from after May 2024, which is the last time that you can take PLAB 1. But again, that PLAB 1 will be conducted according to UKMLA content map. So, of course, but after that, it will completely be replaced by AKT, that is Applied Knowledge Test. So we're going to be discussing what all of these things are in this video today. So I'm very excited to tell you what I learned about UKMLA recently, and I think this is going to benefit you as well. So let's get started. What is UKMLA? Well, UKMLA, the full form of which is United Kingdom Medical Licensing Assessment, is actually a test that is replacing PLAB exams, which was a traditional exam which the doctors from outside the UK had to take if they wanted to practice medicine in the UK. Okay, who is going to give or take, UKMLA? So UKMLA is designed for two sets of people. The first set is, as we know, IMGs, that is International Medical Graduates, graduating from outside of UK medical schools. And UKMLA is also meant for the UK medical graduates graduating from UK medical schools. And you will be surprised to know that UKMLA taken by UK medical graduates is free of cost, but definitely it's gonna cost us fee, just like how PLAB costs us fee. But anyways, now question is, what are the components of UKMLA? Now UKMLA, just like PLAB exam, will have two components, that is AKT and CPSA. AKT is Applied Knowledge Test, which is very similar to PLAB 1 exam, which will have MCQ pattern just like PLAB 1 exam. And CPSA is basically Clinical and Professional Skill Assessment Test, which will be very similar to PLAB 2 exam. And again, what are the similarities here? As I said, MCQ exam similar to PLAB. There will be more similarities, that is, this exam can also be given 4 times a year, just like how PLAB 1 exam is given 4 times a year across the designated places around the world. And again, you can resit it as mentioned in the website. How many times can you resit the exam, and what will be the time gap in which you will have to give your PLAB 2 once you have given your PLAB 1 as well. And that all will be very similar in AKT as well. Now coming to CPSA again will be very similar to PLAB 2 exam, and it's also going to be taken in Manchester. So think about the maximum attempts, that is 4 attempts are the maximum attempts in PLAB 2. Well, CPSA is also set to have 4 attempts as maximum, but they are yet to decide on that. So that is something that will come up perhaps really soon on GMC website. I've already described the differences between PLAB and UKMLA. Well, there are not many differences actually. What it feels like is they have just replaced the name PLAB to UKMLA. Okay, there is one difference definitely, and that is that they have also released UKMLA content map, which will be similar to PLAB blueprint that is released on the GMC website from long. So now, what is the idea behind adding or removing the conditions or scenarios in PLAB or UKMLA? Well, the idea is actually based on current UK clinical practice. Now, if there is a kind of scenario that's coming again and again in UK medical practice, then that scenario will actually be incorporated into these exams. So none of these exams are different in terms of how they are actually made, so created, right? So this is the only idea behind adding or removing any kind of condition in UKMLA or PLAB. Okay, so you can go through the UKMLA content map. I'll drop a link to the GMC website where you can download this content map for yourself. Okay, And the next thing that's usually asked is UKMLA hard? Will UKMLA be hard than PLAB? I would say UKMLA, as what GMC reassures us, is going to be of the same level as PLAB. So there will not be any difference in the level, and if they also reassure that they're going to use the same pattern as they used to use in PLAB. So that's reassuring. So that's something that kind of decrease down the stress and the anxiety that students might be having, or the doctors might be having, who were aspiring to take these exams. What will be the charge of this exam? The fees of this exam is yet to be released on the GMC website, so keep yourself updated by constantly visiting it. So there are some scenarios that I would like to take you through that might be something that you might be puzzled with. So the first thing is, if you've taken both PLAB 1 and PLAB 2 and you've passed it before UKMLA actually came into picture, so in that case you will just have to get registered by GMC, okay? And you can start practicing as a doctor and no one will question you. And the next scenario is, let's say you've taken PLAB 1 in May 2024 and you passed that PLAB exam. But now there is no PLAB 2 available because all of the PLAB 2 is actually replaced by CPSA. So in that case, you will have to take CPSA. Okay, so that's second scenario. The third scenario is you actually took PLAB 1 in May 2024, but you didn't pass it. In that case, of course, PLAB 1 is not available after that. So in that case, you will have to take AKT next, not PLAB 1, which will be, of course, very similar to PLAB 1. But again, you have to keep in mind that the attempt that you've taken for PLAB 1 will actually be recorded as in your maximum attempts that you can take for PLAB 1. So remember that. And then the final scenario is, well, you have given PLAB 1, you passed PLAB 1, you have given PLAB 2, but you couldn't pass it. And PLAB 2 has been replaced by CPSA. So again, you will have to take CPSA in that case, and the attempt for your PLAB 2 will actually be counted to your maximum attempt. I hope I actually answered all of these questions about any confusion between UKMLA and PLAB. It seems like GMC has done their best to reassure us to not get carried away into fright when they are going to implement UKMLA. So please don't worry about it, and of course there will be people who will help you with UKMLA. I will also be in a journey to help you with that in however sense I can. And I guess I forgot to introduce myself in the beginning. I am Dr. Spinach, and if you like my video, please give it a thumbs up, do subscribe to my channel and share it with your friends. And click on that notification bell down below so that you can be updated as soon as I post the latest videos. I hope you enjoyed my video. Thank you very much.